Administrator. Good morning, everyone. I'm Michelle Niehaus. I'm the Program Administrator for Deaf and Hard of Hearing Services at the Department for Behavioral Health, Developmental and Intellectual Disabilities. And this is our third workshop with Makoto, who will be talking to us about skills working with deaf sign language users in substance use treatment and recovery. Before we get started, Anthony is going to go over our communication agreements. Go ahead, Anthony.
Hello, good morning, everybody. This is Anthony Adkins. And I just wanted to briefly talk about our communication rules with using an interpreter and for this presentation. So Makoto is the presenter. So when he's ready to go ahead and get started, if he's starting presenting and you all have some questions, you can turn your camera on and go ahead and ask that, or you can also leave a message in the chat and we'll try to look at those messages and relay that question. So either, you can speak or sign, and try not to do any crosstalk so the interpreter can keep up. And avoid, like doing too much explanation, but if there's an acronym, please clarify that. Put on mute if you would, please, so we have no background noise, and just speak or sign normal. So I hope you all have a great workshop.
This is Michelle. Thank you, Anthony. I will be putting the sign-in sheet link in the chat. You do need to complete that and the link to the evaluation in order to get CEUs. Our CEU folks are running about 1 to 2 weeks behind, so you should receive your certificates by mid-March for today's session. If you do not get it by the 15th, please email me and we'll see what's happening. I know that Makoto has a lot to share, so I'm going to go ahead and turn my screen off and turn it over to him. Welcome, Makoto. We're so excited to learn from you again.
Yes, thank you for the introduction. So I'm going to go ahead and share my PowerPoint on the screen, okay? Can I share my PowerPoint on the screen?
This is Michelle. We forgot to test that before. So you should be set up. Actually, you should be set up to be able to share. It says all participants on my end.
Do I have to be the co-host or no?
No, you should be able to go ahead and click share screen and it should come up for you. Same as last time.
Oh, okay. I think I got it. All right, so my PowerPoint's showing up there, guys. Okay.
This is Michelle. Makoto, can you hit the start slideshow? Because we're seeing lots of screens.
Oh, okay. Yeah. Oh, 1 second. Slide or next.
This is Michelle. If you go to It should have a start slideshow option. I'm not, it looks like you're on a Mac and I'm not familiar to Apple. Maybe go to the left to your view.
Got it.
There you go. Great job.
Okay. Hi, good morning. Sorry for that start here. Thank you all for coming and happy Friday. I know some of you, well, many of you, have had a long week. And happy March. Wow, it's like time went so fast. Today's already March 1st, and I'm ready for Friday, ready for the weekend so we can rest a little bit, have some coffee, watch some TV, just relax. So thank you all for coming today. So I kind of want to do a little bit more on reviewing our skills and our abilities, and our awareness to encourage and provide support with deaf and hard of hearing for substance abuse um, uh, users or use disorders. So um, we're starting kind of with like a system perspective, discussing the different skills and awareness. And different individuals and clients have different perspectives, that have changed over time. But we want to kind of look at a system perspective and review some of that. So I think we have a great group because we all have different experiences, different positions, and different levels of understanding regarding this topic. So it's good that we can have some different perspectives and some different identities from different, paths that we've been on, and that we can help and learn from each other. So some of you, I think, were not at the last training, but I'm not sure if you all who were, if you remember, I showed uh, some of my visual aids that I used from my old job at a recovery program in Atlanta, Georgia. So I use like those different feeling charts and different faces that shows the different feelings. So I'm hoping that you all kind of thought about that in the future. If you all have a deaf client that comes into your facility, if you have come up with some different ideas or developed, some preparations in order to help that deaf client, if there's been some different visual aids that you've thought about using, since I mentioned that, um, or if not, that's okay too. It doesn't have to be specific homework that I assigned to you all. I was just curious if anybody's applied any of those visual aids. Or if any of you had any thoughts or feedback after the last session that we had about 2 weeks ago, if anything's come up for you, or anything that you could think about, as far as deaf or hard of hearing clients, how to communicate with them, how to provide interpreters, how to use different technology to help with communication. Didn't know if anybody had any thoughts or any questions that had come up since then. Oh, I saw the chat, Michelle, that you had sent. All right, so if we don't have any comments right now, we'll move on. So now we're going to talk about the learning objectives and with regarding the ASAM criteria Do you all know what that acronym stands for? It's American Society of Addiction to Medication or Medicine. So it's called ASAM criteria. And it's kind of trying to see like how severe of an addiction the patient might have, and help to make a decision to see where they are on that range of addiction and severity, in the different areas that we would need to be knowledgeable about, to intervene or to help with that client or patient with their substance use disorder. So that's the ASAM criteria. And we'll talk a little bit about that. And some of you already might know about it, some of you might not. But just trying to see how that criteria can apply to deaf consumers. So we're hoping to kind of talk about that a little bit and use that as a beneficial tool. So it's very important and very useful, to try to make sure you get the appropriate assessments, and know about the different challenges and the different problems from the system perspective, and how some things can be missed, especially if you're on the front line of all of this. And you can see a problem from a different perspective. But those who work like in management, they might miss something because they don't understand the frontline challenges because they are not there in that role. So it's important to use the different systems of theory so that you can be more aware of the different challenges on all of the different levels. And make sure that you have that in your mind when you are working and trying to be, successful for those clients. And so there's so many different tools that you can use, and they can all work together and also benefit communication. So with ASAM criteria, there's also the EST system, and that's looking for different gaps, and how you can cover those different gaps. Sometimes there's a gap that somebody is not aware of, and you might learn from that, and then you can apply it in the future. Okay, yeah, I do see the chat here. That's great. Somebody had shared in there a visual aid. Perfect. That's very cute. I think it was Carlene that had shared that. And it says, which chair are you sitting in today? And it has like the different feelings right there. Wow, I really like that. That's cute. I think that's good. And we can definitely use that. Thank you for sharing that. Thanks, Michelle. Oh, we're going to switch interpreters.
So we've already explained the ACM criteria, and the important word is here in that last sentence. That last sentence in that PowerPoint, it says, psychosocial, and that that word can be broken down. When you're looking at a person with addiction who has struggles, you have to focus on the addiction, the range of addiction. How bad is it? How ready are they to recover? you have to look at the whole picture, the whole overview. It's like a house. It's a support system. Does the foundation work? Do they have family? Do they have community? For their medical health and their mental health, it all works together. It's a holistic approach, and it's very, very important. Often we see people emphasize that, the 12 steps or different resources for mental health. And it's very important for them to complete those, which is understandable. It's important for them to understand how to use it as well. Very important. But also at the same time, we need to make sure, because everybody has different identities and different reasons that impact their addiction. Everybody had the different root cause that got them to where they are. Some things can go away and can heal, and then they can get into the 12 steps and feel like they're ready. But then once they get out of the meeting, that root cause is still there because they have no support. They have just no system around them that they need. They need a collaborative, holistic approach. And we'll talk about that more in this next slide. The ACM criteria has recently changed. That third one, or sorry, it changed from the 3rd edition to the 4th edition. It is pretty similar, but you can see some changes there between the 3rd and 4th edition. In that right column, it's the 4th edition ACM criterias, and that's the six different criterias. One was removed from the 3rd edition, and that was ready to recover. They removed that, but then the 4th edition added on person-centered considerations. That number 6 right there, person-centered considerations. And we'll expand some more. I know we got to make our time. So as we just discussed, they had the new number, the 6 steps, and that's called the dimensions. It's just different perspectives, and the word they use for that is dimensions, just like an aspects, different aspects. So first we're going to look at acute intoxication and or withdrawal potential. And that's the first step of getting into like detox or like going to an emergency room. Just a emergency response for a crisis situation center. If they have a high level of care and they can't control themselves, maybe a medical professional needs to be involved. So what do deaf people face during this? They can have any level of specialist, an outpatient therapist, inpatient therapist, state manager, everybody can be involved. But what do they need to know to work with a deaf patient? What skills do they need to have to prepare for providing successful advocacy or assistance for that patient who is intoxicated, maybe stumbling? So what issues do they face? Often they experience this situation, and the communication is always a challenge for deaf people. But then now we've also got them intoxicated, and it's hard to assess their communication skills. With hearing people, usually they can talk and they'll stumble across their words, and you can kind of make do with what they're saying. But with a deaf person, if no one can sign or they don't have an interpreter there or something like that, how do you communicate with them? So in our other training, we already talked about how to prepare for if somebody was seriously withdrawing, just really out of their mind, intoxicated, or on some kind of drug. You can contact Michelle Niehaus, who is in the Department of Behavioral Health, and you can let them know, hey, we have this patient, and what resources do we need? What resources do you have? And she can get in contact with people to make sure that there is clear communication between the patient and the healthcare provider. Now, this is dimension 2 for the prevalence of to deaf patients. And so once they're in there, we have to assess. First, we have to figure out what resources we have, what resources we need to communicate. And once they're in and that's all worked out, and now we sit down and have our assessment with them. You can't assess your patient without communication accommodations, obviously. Just how would you assess them without any communication? You could kind of identify some things based on just observing. But then there's another aspect of it. You have to ask questions. So you're going to have an interpreter here or some kind of technology, something to help you with communicating with your deaf patient. Assessing is very important because based on your assessment of that person, you decide your treatment plan going forward. So once you decide that level of care, you have to figure out what resources will benefit that person. So assessment is key. That's where you begin. And if you get wrong information or have the wrong assessment, it can lead to negative effects. It's very important to make sure that we match the patient's communication needs and emotional needs. They might need a deaf interpreter, a certified deaf interpreter, maybe because they're in withdrawal, going through that experience, their mind is foggy and it's not very clear. Maybe something traumatic happened to them. Maybe they got fired from a job. Something happened in their family. What led to this moment? Maybe they have that language, but they just need some support culturally. So if you bring in a deaf interpreter, they can help with all these things. Cultural sensitivity and clinician skills hand in hand, along with communication skills also are very important. Somebody who can assess their communication skills, just all of these things collaborate and work together to assess this person's needs. It's a lot of energy wasted if we don't make sure that we get the right assessment. So then going forward, if we have a detox situation going on, like they're staying in the hospital, we often see with mental health episodes happening or symptoms after drug or alcohol detox. After it is out of their body, you can see their mental health situation. Like a psychologist or psychiatrist may assess the situation and identify their needs after the detox. Most people who have substance use disorder have some kind of mental health challenge that they're facing or some kind of serious life event that led them here. So it's very important to figure out what's happened before this began. And this is the part 3. It's the psychiatric and cognitive conditions. So this is where we continue to assess, and this is important as well to have communication with your client and make sure you identify everything correctly, have the right diagnosis and plan going forward. And once you figure out what's going on with their mental health or cognitively, if everything's intact and what's going on and how to treat medically or emotionally or behaviorally, then we need resources for, like maybe they will need to go to a meeting afterwards or some education about recovery, a 2-step program maybe, just learning more about their unique needs. Not all mental health challenges have addiction, but most people with addiction have mental health challenges. Some people don't need the 2-step process, but the mental health community is very benefited by the 2-step policy. So then we have to connect all the resources and make sure that we have a relapse prevention plan. That we can make sure that they follow. We need safety preparations and crisis for, like, just like you do for mental health, they have that for addiction. They have the relapse prevention plan. If the person feels like they're tempted to drink again or use again, then they obviously face a lot of pressures of wanting to use again or feeling like you're ready to drink again or use again. What would you do? You could refer them to a relapse prevention plan. You all know that recovery is not the end. It's never ending. Just like mental health is never ending. You can't cure either forever. Sadly, I wish we could, but sadly, you can't. But you can control them. You can control your mental health or your addiction. It can be controlled. You can avoid getting put in the hospital. You can avoid many things if you prevent it from happening. You have to have the right environment. You have to have the right support, the right living situation. A good support system is very, very important. You can go to a meeting or meet with your sponsor weekly or make it routinely. A sponsor is usually somebody who has faced addiction in the past and has been recovered for years and years. Someone that you can look up to as a mentor to help you get through things. Sponsors are much like mentors. And that becomes somebody who changes roles from an addicted person somebody with an addiction to somebody who can become a role model. And it's an excellent resource. If a lot of people, if they don't have that, they go back. And now we're going to talk about Dimension 6, which is the last one, and it is the new one that they've added on, switching interpreters.
All right, so the last one here that they added to the 4th edition, person-centered condition. Again, it's speaking about person-centered, kind of a general phrase, but then there's different barriers to care. So it's important to break down those different barriers. And there's always going to be some type of barrier there, of course, but we're trying our best to break those down and figure out the barriers and get through them to find a path to recovery that can be successful. So often, we focus on the addiction problems, and like the 12-step program. A lot of people have already read that type of a program and that, book. So it's important to how to apply that. There's in the meetings, but then outside of the meetings is also important too, like a case manager, or a VR counselor, or really any type of professional that can help this person to get what they need to build that foundation, to be more independent, and follow their 12-step program. Without a foundation set, it's just going to fall apart. And the 12-step program, can be something they just talk about, but not really use and not really apply. So it's important to look at all sides of that. And you can see that picture here that's talking about the holistic approach, including like money and health and all of that. So this little graphic is just something we emphasized before, with deaf and hard of hearing, that there's not always just one perfect thing. You need to ask the client what works for them. What's their preferred method of communication? How do they want to receive access? Everybody's going to be a little bit different. So it's very important to ask and not just to assume, and just put in this interpreter and bring an interpreter. But what if that person doesn't want an interpreter? So you need to make sure you ask them and make sure that's something that they want before you go forward with it. When you ask questions of the clients or the deaf participants, it's important because you're giving them some empowerment to make their own decisions and have a say in their treatment and in their recovery. When you ask them, how do you feel and what communication would you like? Normally it makes them feel pretty good about themselves. They feel like, oh, I have a say in this, and they can make a decision what matches them the best. Because lots of times growing up, people just make all these assumptions for deaf and hard of hearing people and force them to do things that they want to, like, for example, lip reading. But if you aren't trying to force somebody to use this, specific method, it's more empowering to ask them what they want. So this graphic I pulled up says one size fits all store. And like we talked about before, one size does not fit all. Like if I go to a doctor's appointment, I'm going to ask for an interpreter. But the other day, this place that I went to, maybe I'm not going to ask for an interpreter. It's going to kind of really depend on what I'm needing and what I want in that moment and in that office. It can change. It depends on that person's identity at that time. It also depends on their hearing ability. Maybe before they were a little bit hard of hearing and they would lip read and speak for themselves, but then what if their hearing has gotten worse and they have more hearing loss, then they might not be able to communicate in that way. Do we have any questions so far? Anybody need to say anything? Nope. Okay. So here's the criteria in the chart here that shows the different dimensions and the different perspectives here. This shows the different levels of treatment. And I guess you could say the levels of care. That would be about the same regarding like mental health levels of care. That would be pretty much similar. So before, when I was working in Atlanta at the addiction treatment program, um, it wasn't inpatient. It looked like it was inpatient. They have a nurse, but they don't give prescriptions or medications. The people would have to go out to a doctor to receive those prescriptions and medications. So before, when I worked there at that program, they would say level 3, is that orange color. So I guess I'm wondering, with your all's agency and your programs and services, which level? Oh, I'm sorry. I think I said that wrong. Anyways, there's different levels here. So like there's like a residence place talking about like a halfway house, and people who are recovered living together and supporting each other in the same residence. So you see like 4, it says outpatient, and that's very severe, um, intensive outpatient. And then there is residential. And so that would be an inpatient. So with your all's agency and different things, what like levels of this do you all serve? Okay, well, let me go back here. Yeah, so I see, oh, somebody made a comment. Oh, okay. Thank you, Michelle, for responding. That most of you all are probably just doing outpatient recovery community centers, meaning level 1, 2, maybe like level 1 or 2, not like the upper levels. So if there's somebody that would need that kind of care, would have to be referred out. But like Michelle had mentioned, her department tries to get involved as much as possible, make sure that people have the interpreters and communication that they need. Okay, I see a few more comments here. So with the level of care, there's intervention, early intervention. Oh, yep. So 2 weeks ago, I think it was Ron had mentioned that many deaf people don't know about the resources, and that many people don't know that they have different options, and so it's important to spread the word and let them know, like, with the early intervention, to make sure that our deaf community knows the different resources. If we have a problem and there's friends or family that might have a problem with some type of drug addiction, it's important, to know about these early intervention resources and to spread awareness of the different resources, and educate too. Like, some people don't really understand what addiction means. They think, oh, I'm just socially doing this, or it's marijuana, it's no big deal, it's a painkiller, or I have a license, a medical prescription for that. They try to minimize like their drug or alcohol issues. So they might need some type of education to kind of explain more about what addiction actually is. And so that they can know that there's more options and that there's different ways, to figure things out here. So our deaf community, like the goal and the dream for most people would be to have all the different levels, right? Like a recovery center, outpatient therapy, um, residential programs, inpatient, deaf departments, all of those things would be really nice to have that, so you can have smooth transitions, like aftercare plans. And, if you need more structure or more medication, then you could just transfer over here. Or if this person needs more of like some social worker assistance, then you could transfer over here. So the goal would be to have all these different levels and transition easily between them. But the main goal is to still talk about communication. So Michelle's workplace, really tries hard to work on communication and providing access, and also sharing resources on what's available. So, we're talking about setting up video phones, there's no charge for that. Um, you just have to have a space to be able to put the video phone and get that installed. So sometimes deaf patients need to make a phone call, and so then they could come to your office and use that video phone to make their calls. A lot of places don't understand that something that simple can help provide access to people, because some deaf patients don't have phones. And also in different places like facilities, it can be safety issues, so they're not allowed to have their personal cell phones or anything. So a video phone would be really nice to have in that kind of a setting too, or a computer that has some type of limited access, that they could only use like the relay service through the computer. So it's just important to think about those different things to provide support to the deaf community. So does anybody have any questions so far about the ACAM? Is there any type of gaps that we've noticed as far as like, do you feel like these resources are beneficial? To make sure that you're matching your patients and their level of care. So, do any of you have patients that need kind of other resources to provide support to help them become successful? Different approaches. Maybe they need help finding a job, or maybe they need help getting Social Security set up, or they're having some issues with court and they need legal help. It's important to have this information to be able to share those resources and include stuff in their treatment plan as well. They might need more resources than just the treatment that's been given. So if you notice that there's a gap and something's been missing, it's important to provide those if possible, to see the system kind of as a whole. So you can identify the different issues that are missing and try to be, more of a collaborative effort. Let me read that chat. I saw something come up. Okay. Yeah, I didn't see anybody take their cameras off and put their cameras on, so I don't think there's any comments or questions thus far. But you can always also click that raise hand kind of thing, if you do want to mention something. Okay, so I guess we're good. So we'll keep going to the ecological system theory. I think that's kind of more with social worker, or maybe even just general mental health. But I know social workers do emphasize this. And when you're looking at a problem or a challenge, that it connects to different areas. Before I used to work as a therapist on the front line, and I would struggle and have these different challenges, and I'd feel like everything is my fault and not effective. And then I noticed the different programs had challenges and departments had challenges. And I'm like, we need more resources. We need more money for, to do more of like action on this, for the staff or the ASL staff and then the different departments understood that if they could put that into their budgets, like obviously they couldn't do that right at that minute. They had to wait till the next fiscal year to be able to add these in, but they would ask the CFO or CEOs about getting some extra funding for these different departments, So it was challenging trying to work through all those different levels to get what we needed. But it's important to get support and help from the system as a whole. There's different system levels and different things are included in those. Okay.
So you can see in this graphic, there's different circles and they have the different systems. A person, and then a microsystem, a mesosystem, an exosystem, a macrosystem, and a chronosystem. You don't have to memorize all these systems, not the words for them, but it's important to know that there's a person and then their family and their group, their community where they live, um, which group they belong to. Maybe somebody belongs to a Black, Asian, Hispanic community, maybe a deaf community, maybe a professional community, could be an LGBTQ community. They could belong to several groups. Could be low income, social economic differences, and the community that they live in supports each other in that way. And then beyond that, there's their state, their country, the world. I mean, it gets bigger and bigger. Your beliefs, the systems are just, they get bigger in that way, as you see in the picture. Now do you see on the top left where they have the picture of the ear and it has all the machines that is in it? It might be disgusting to some people. It might be triggering for some people. But hearing people look at that, and I wonder, do you guys have any thoughts looking at that picture? What do you see? Not just the picture itself, but what is the overall meaning behind it? All of these pictures that are on this PowerPoint will be shown more and more, but they're all deaf artists that have made these, expressing their feelings and their experiences and their lives. Their drawings have no words, but I think it's clear enough, the meaning behind it. I think you all could easily get the message that they're trying to come across. To me, it feels very powerful. And when I go into an art museum, I feel overwhelmed and I don't understand a lot of it. I think some of you could agree, but to me, this is powerful and I could understand this clearly. Is there any one message that feels impactful to you all from any of this artwork? If there is, feel free to type it in the chat or tell me on here. Autism has a medical view and a cultural view, but we want to approach this from a cultural view, not a medical perspective. Deaf people feel like, I don't want to be fixed. I don't want you to fix me. But I know that the hearing perspective is, oh, poor deaf person. They have problems and we need to fix it. We need to help them get better. And culturally, we don't feel that way. We feel like we don't need to be fixed. So I know that there can be some controversy. I understand their perspective. I've went to an all hearing school and I have a family that's all hearing. So I understand the medical perspective, but sometimes we feel like they're trying to benefit financially from the situation. For Social Security purposes, if you're trying to draw Social Security benefits, then you have to call yourself disabled. I have a hearing loss. I need this money. So I know there's benefits to it as well. But medically, for mental health, I don't think that people should make decisions for deaf people. I think deaf people should be involved in the decision making. And it's the same for communication preference. You should ask them, what is your communication preference? There was an addiction program that I used to work in where a house manager came up to me and said, hey, and said each of the clients' names, so-and-so and so-and-so and so-and-so want that. What do they want? And I said, I don't know, go ask them. Why don't you go ask them? Why are you asking me? I'm not that person. I'm a Kodo. I know what I want. I don't know what that person wants. Um, that, you know, everybody's wants can change every day. I know their preference, what they usually do, but yesterday I wanted this meal and today I want this meal. So your preference can change. Maybe I don't want to eat an apple like I did yesterday. So we can't just assume what the deaf person wants. Communication is key. You need to ask them. You can write it down, you can gesture. If it's therapy, you can discuss, and you need to discuss, you know, for a long time, then it's good to have an interpreter in that situation. But you can talk directly with that person for a short situation. Just like when my parents come with me for my doctor's appointments, they tried to help too much. They tried to take the lead. I know that I'm disabled on paper, but that doesn't mean I can't do anything. So look at that bottom picture where you see that person being controlled like a puppet. That's kind of what I picture in that situation. Do you all have any thoughts? Feel free to comment. Okay, time is running out, so I'll keep going. But this is the ecological system theory. I did just show you, you know, the circles with the different systems going from small to large. But this just explains the definition of each system, what it means. So you can read that slide. An individual, family, groups, communities, culture, where you live, your state, your country, it gets bigger and bigger and bigger. Let me look at this chat. Dylan was talking about that top picture. Let me see. Top left. Sorry, I have a hard time trying to find my rights and lefts sometimes. I'm from Japan, so we use a different right and left. So it takes me a minute to think about it. Okay, the left top feels like it needs to have a foreign device attached to your body at all times. Yes, yes, just adding like machines and putting them on you and in you. Yes, you're correct. The perspective is trying to help them live better in the world. I know that they have good intentions. There's no ill intent there, but the other issue there is I'm always telling hearing providers that I understand you have good intentions. I know that you're just trying to help, and that is very important. If there was nobody that tried to help, then you know things could be bad. I think that you have a good heart, you have good intentions, but that doesn't always provide positivity. Sometimes it oppresses people. If you're helping all the time, helping, what does that look like? Does that mean you're taking over for them? Or are you letting them in on the discussion? Are you letting them do some stuff by themselves? They might fail, but failure can lead to big lessons learned. If the risk is dangerous, obviously, yes, we'll do more training, more assisting. There's a boundary there, but you don't always have to take over. You don't have to call people for them and do everything for that person. That person needs some independence and some power over their lives. If you're making phone calls for them, then when they get out of the program, they might still not know how to make phone calls for themselves. And then it just leads to relapse. So it's important to help them gain some independence. I know that there's good intentions there, but before you provide support, we have to think about how our behavior is impacting or affecting their health or their healing process. So it's just an important thing to think about. Making sure we have time. Okay. So what do you see in this picture on the right? On the right side of this slide, it says mental health service. What do you see? Do you all see the picture on the right of the PowerPoint? It has 2 doors. There's 2 doors there in that picture. Do you see that? One door is a large opening with a lot of people going through. And the other door is a smaller door. And people are outside just circling, walking around. What do you think that means? Beautiful. Vondre said people carrying the weight of stress and worry. That's beautiful. The people on the right do seem to be doing that. In that outside of that small door, they have those large, heavy bags weighing them down. And that could be the weight of of worry and stress. You're right. If you have no service provided, Rachel said, I'm reading what Rachel said. Yes, people who have bigger burdens have not as much access to services as those who have less. If they have so much on them, the weight of the world, stress and worry, from those different systems, family, school, healthcare, jobs not being available, that all of that can just take a toll. It can weigh them down, and then spending so much time looking for services and then just being weighed down. That's a good explanation. I like that. Yes. Vondre again said, yes, something great. She said maybe they're walking in circles because they feel no one can help them and they have nowhere to turn. They're just outside walking in circles, wondering where to go. They have no help, no support. They feel stuck. They could be on the street. They could be in jail. They could be isolated, abandoned from their family. Or maybe they went into a service, maybe they went into a hospital or an agency, but they didn't know what resources they had outside of there. There was no training or no mentoring, no counseling so they get out of these. They're in this safe place, of course. They were provided food and water, their basic necessities. They have a roof over their head, but there's no access to treatment afterwards. That's another barrier that deaf people do face. Just because you go in the door doesn't mean you're cured. There's still barriers in the door as well. You see that small door, or sorry, the big door, you see that there's other doors in there. There's other barriers. The door for deaf and hard of hearing people is so small. It's tiny. You couldn't even crawl through it.
All right, we're gonna switch interpreters. Ron, did you have a comment? Can you see me? Yes, we can see you. Can the deaf people see me too? Yes. So thank you for describing the 4 different levels, like second, third, and fourth. That's, really informative. Like walking into recovery, and looking for help for a deaf person is challenging. It's very scary because there's this one lady that I know who lived in sober living. and has 7 months left and is very afraid to be kicked out of there as the time is running out, and I try to tell them like, okay, you just need to kind of calm down a little bit and, relax and try to find a different place. The time's not up yet. But I, asked her if she wants to live in an apartment and if she feels ready for an apartment, and so it's wanting to make sure you ask that person if they're comfortable moving, to an apartment. Like you really need to make sure you ask them their opinion if they're ready. And who do you reach out to for that? And thank you for that question. Makoto said to Ron, Michelle, is there anyone that would you like to elaborate on that? As far as that situation Ron just mentioned? Michelle? Ron said, I don't know. I don't see anybody else on here.
This is Michelle. I just turned on my camera, so it might depend on how you're set up, Ron. The housing situation depends on where a person lives. But Ron, you're absolutely right. First, you need to ask what that person wants and then work with the local agencies to figure out.
I can't see anyone.
Can you see the interpreter?
Ron, can you see the interpreter? No. Do I need to take off the PowerPoint or something? Makoto's asking. Should I turn off my PowerPoint?
Michelle, yeah, turn off the PowerPoint briefly.
Ron, can you see people now? Yes, I can see people. So you're asking about the apartment and different options, right? Ron said yes. The person wanting to move, but trying to see if they're ready to move to an apartment. I don't know if they need to reach out to like their coach or somebody to, find a way to move to another sober living, maybe for another year. I don't know. So Michelle's saying it depends, if that person's not ready. And Ron said, no, I'm not judging them. Michelle's saying if the person, wants to move to that place, maybe the case manager can help. And you could refer them to the local community mental health center for help to get a case manager to help with that. Ron said, oh, that sounds good. Michelle said sometimes, they have the recovery centers that can refer to housing for an apartment, or they might have other options, but we can discuss that more later if that's okay. Ron said, sure, thank you. Okay. So that's a great question, Makoto said. With limited resources, it is hard. It's hard for, referrals to get through sometimes. And, let me give you an example of when I was at that working at the residential program. They could stay up to 2 years, which was nice. Most of them would recover, doing the 30, 60 or 90 days, but then they just felt like it wasn't easy to, get out of that type of a treatment center. So at my old workplace, they could stay for up to 2 years, but I started to notice that, lots of hearing people have so many different resources. They can sit down with somebody and say, okay, what do you need? What's your treatment plan? You need a job. Oh, you need a house or a place to live. Well, you can call this person about a job, like they just have a lot of stuff ready, and like they don't need to get an interpreter and make an appointment to make sure they have an interpreter. Hearing person can just call and go in or just make a phone call, and like it seems so much easier. But while the deaf people, do not have the same access, and they have like the language deprivation, like 15 minutes for an appointment is not going to be enough to explain all those different things. They need maybe like an hour or something to go through all that information through an interpreter as well, and you just have to identify what are the people's goals and how can we successfully, help them to get through that. As like a case manager can set up different referrals to different resources, but maybe people don't know about all of them as far as, like working with a deaf individual or providing an interpreter. So, it takes extra explanation to tell them, this person's going to need an interpreter, and maybe contact Michelle's department to see more about getting an interpreter and how that works. So for my experience with other people, even after 2 years, they weren't ready. Like they made progress, of course, but they just weren't sure about moving on out of a, recovery program. So, those different levels that we've discussed, like they feel like they can be kind of independent, but they're not 100% sure or ready. So the programs have different structures and different classes offered, and a case manager and, treatment, and, it's all day, all night kind of availability. But then, where are they going to find that type of environment outside of that? They might find a case manager, but is that case manager going to be skilled enough to find them the different resources that they need, looking for a job or trying to set up, Social Security or unemployment or things like that. Often the deaf person, that does different services like that might have to have lots of different roles. So it's different. It's important to know the system, and, Michelle is a great person and a great resource to reach out to see what's available. She helps so much with the access to the deaf community here in Kentucky. And so finding the different trainings and, maybe even finding like a mentor or something, it's important to have like a big picture and a collaboration idea. And if that person's not ready, then that's fine. And Ron's saying, yes, I will definitely contact Michelle some more. And we, help each other quite often. So we can talk about resources for that. Thank you. Hold on. Let me try to share this again. I have 2 slides left. Okay, sure. That's fine. And then it has a resource list as well. And like that Department of Behavioral Health, that Michelle, works at, there's different things, the sensitivity training, ASL classes, video, phone, technology setting up, different things, like Michelle's department. If you're missing something, she's probably the best person to contact to see about getting that information and collaborating and working together. So Michelle's department is great for that. Okay. So I have about 20 minutes left. I gotta get going. Do we have any more questions? Okay, so the last thing is just talking about what did you learn from this training? Different examples could say, I learned that, I wanted to do this, this, and this. I learned that I need to have this to work with patients that are deaf and hard of hearing with substance use. Or I can use different skills or strategies to improve on different things under treatment for the deaf community. So, it doesn't have to like be completely, a long explanation, but I would just like to know if somebody has come up with an actual, thing that they've taken away from this training and what you plan to do with it at your job. Does anybody have any comments here, anything you want to share? I think we have about 20 minutes left. Or if anybody needs to share resources, that's fine too. I know it's Friday, everybody's tired, huh? Hi, this is Michelle. You give a lot of information today. Thank you. The ASAM criteria, I think, was very helpful. And thank you for, relating people to contact our office. There is a lot of information that I do have for statewide services. And we want people to be able to, contact people statewide, not only me, but, other different people around the state as well. And we've set up a task force called Eyes on Hope. And that's trying to provide help for people who need services, family members, people in recovery. We try to meet 2 or 3 times every year, discuss barriers and how to break down barriers in the system. So if anybody would be interested in joining that, please email Anthony. I put his email in the chat. And I'm just curious, if you could pull up your cameras here and so we can see you, and if you can kind of let me know if you've been to all these, what you've learned thus far. Is there anything that surprised you or shocked you? Like with the therapist, maybe you might say, oh, I finally understand this now that, this has been explained, or, is there something else you're curious about? Any feedback? Julie. Hi, this is Jules, mental health therapist for 7 County Service for 15 years. And so I've seen some consumers ask about substance use disorder services. Often you have those, but they're not exactly accessible. So, I've, talked to many people and educated many people about how to provide an interpreter, how to schedule an interpreter. But the challenge is with some of the clients. I'm not blaming the clients by any means. I'm just saying that we have to educate them. If they are late or if they can't make it, they need to communicate that with the office, and because oftentimes that's a barrier of even trying to empower the clients to communicate with the providers. Michelle said that's an interesting point from from the provider and from the deaf provider, trying to find a match for access and for treatment. And also at the same time, putting some of that on the client, to learn how to navigate the system and, to understand the expectations. The world of treatment has different rules and different, vocabulary and different things. And it's important, like you said, to be on time. So the client, if they need help, trying to, live in both those worlds and understand those different things. We're going to switch interpreters.
Dylan, did you have any thoughts? What were you thinking? Just curious.
Yep. Yeah, I was just I put it in the chat. I was just talking about how it's interesting to learn. There's a lot of different barriers or challenges in communicating with a deaf person than as a non-deaf person than I would realize, and their perspectives and approaches to getting them access to recovery options.
Yes, you're right about that. Mm-hmm. Now, what agency do you service? Do you provide mental health or? Self-ad,
I am a peer support specialist at Louisville Recovery Community Connection. And
okay,
I just help guide people to different resources, or including recovery, but not limited to that. Just trying to help people in any way I can.
great. All right. Ron,
Thanks.
I was wondering if you've had any deaf patients come into our LRCC recently.
Yeah, actually, not a lot, but we have had a few, and we've been able to help them, connect them with resources, and yeah, we've been able to use some of the things that Michelle told us about, and speaking with Ron Morrow, and yeah, we've been able to assist them, and that was very rewarding. You know what I mean, to say the least.
Great. Good to hear.
Yeah.
And Makoto asked, what is LRCC? And Ron said, that's Louisville Recovery Community Connections.
Yes.
Okay, I understand now.
Yeah, we are a community center geared towards the recovery community in Louisville. So we take appointments to connect people with resources, peer support services, and then we have different social events for the recovery community and all other communities within that and around that. And then during the evening time, we have different recovery meetings. We have 12-step, but we also have different types as well. Smart recovery, YPR, all recovery, sex and love addicts anonymous. We try to diversify and help as many people as we can.
And do you all provide interpreters?
Yes, we do, upon request. Yes.
Oh, great. Michelle has something.
This is Michelle. Let's remember our communication rules and raise hands. We also have 14 other recovery community centers across the state, and all of them are able to provide interpreters upon request. We also have new deaf or hard of hearing peer support specialists, and they can provide direct services in person or virtually. So reach out if you have questions about those resources. The recovery community centers have been wonderful in terms of getting video phones in place, getting additional training, and learning from that peer perspective how to support folks in recovery who are deaf or hard of hearing. So we're looking forward to even more in the coming year. We do have budgeted starting in July for 2 more peers to do office hours at recovery community centers across the state. And Ron is currently at Recovery Cafe on Tuesdays for a couple hours each day. So if we see needs increase and people come to those hours, then we'll work on ways to get funding to also increase their time. But right now we're just trying to grow the program. It's pretty tiny at the moment, but we're a lot further than we were this time last year.
That is wonderful.
I put in the chat, the link for your evaluations. Please make sure you complete your evaluation. And Daniel's asking in the chat if we have a contact list for the peer supports. What I will do, I'm going to send a follow-up email for this training. And with that follow-up, I'm going to send you a peer support referral form. Our peers who are doing one-on-one services are currently doing them through Bridgehaven. And then if we have requests for other RCCs, then I can help you get connected to those peers depending on where they're located. So right now we have people not all across the state. We're still kind of mostly in Northern Kentucky through Central Kentucky, but we are hoping to get more in Eastern and Western Kentucky as well. We do have Joey, you're in Western Kentucky. He's a peer support specialist who's at CODA, a child of deaf adults. So sometimes our peers may not be deaf, but they are connected with the deaf community.
That's great.
Makoto, we have about 9 minutes left. I'm curious if you have thoughts for wrapping up. What else can we learn from you in the few minutes we have left here?
Yes, I think that treatment, deaf treatment or ASL treatment, or sorry, therapists or case managers that are qualified. I think that that is very important, and getting them into human resources and training is very important as well. And like you said, just having knowledge about the resources and spreading that's wonderful that you all are doing that in Kentucky. Um, for example, though, I don't know if you guys can do this, but for a possible example, if your agency or center has um, a video phone, I don't know if a lot of people know about it, but I think that that helps. Maybe adding a second picture on a website somewhere, maybe you can put that, or a picture of an interpreter or an interpreter logo. That way they can see, oh, they accept deaf patients or they support deaf patients. Just something little to put in your website if possible. I know that somebody higher up has to make those decisions, but just something little like that could really affect the deaf community. Just seeing that, knowing that you're included, maybe just something small to let them know that you will provide interpretation services. That's just something to put in the back of your mind. And feel free to get in touch with the local deaf agency as well to provide more ASL classes, ASL events for training. They can't provide behavioral health clinic training or anything like that, but they can do cultural training or some basics. And maybe you've already done that. Maybe you've already worked with them. But if you have new staff members in the future that need like a cultural one-on-one, that would be nice. And just to get in touch with somebody in the deaf community that can help improve the system as a whole. I'm hoping that you all can use the system theory and the ACM criteria to kind of be a little more flexible for deaf treatment. It's not a one treatment fits all for deaf people. It's different, and the impacts that deaf people face are different as well. So you have to be cautious in how to support each other and continue to look for more resources. The ASL group is a great way to get in touch or to keep in contact. It's wonderful to see that Kentucky is developing and growing. I'm very thankful for you all.
Makoto, thank you so much for these last 3 workshops and for working with us to share your vast knowledge. I know it's hard in a virtual environment. I wish we were all in the same room together. But we look forward to hearing from you in the future, and knowing that you're out there doing this great work is really important to us too. Thank you to our communication access providers, to Heather and Kayla and Laura. And thank you so much for all of you who attended 1, 2, or 3 sessions. And we'll be sending out a follow-up email with resources. And then we will also be sending out your certificates if you have signed in and completed that evaluation. So we are grateful for all of you, and I hope you have a wonderful rest of your day and a great weekend. Thank you so much for coming.
Yes, goodbye. I'll see you guys later. Please email me. Come to Atlanta, Julia, or Jules, sorry.